Dear organizers and guests of this webinar, first of all, thank you for putting your name and effort to organize this webinar. And thank you for inviting me to speak on behalf of National HCV Elimination Program of Georgia. Despite the major successes achieved towards the elimination, hepatitis C infection still remains work in progress. But ongoing COVID pandemic actually showed that thanks to the steps undertaken within the implementation of HCV program, the overall national COVID-19 response capacity has increased significantly in general. In my presentation, I'm mostly going to focus on the laboratory diagnostic strategies implemented at different stages of the elimination program and the outcomes of the steps taken towards the improvement of the laboratory diagnosis of the hepatitis C infections throughout Georgia. Please, next slide. Now let me start my presentation with a brief overview of where we started 5 years ago before the implementation of the National HCV Elimination Program. Based on a sero survey conducted in 2015, prevalence of chronic HCV infection was 5.4%. The survey also showed that the main genotype in the country was a genotype 1 and followed by genotypes 3 and 2. Next slide. In 2015, with active involvement of the Georgian government, of USA CDC also, the HCV elimination program has been started. The implementation strategy was approved years 2016, 2020, and 20 with the ambitious targets of diagnose 90% of infected individuals, treat 90–50% of diagnosed patients, and cure 90–50% of those treated. The strategy consists of different directions, such as promotion, awareness, advocacy, education, HCV prevention, infection, HCV infected persons, identification infected persons, also lab capacities, HCV care and treatment, and surveillance. Multi-sectoral working groups are involved in improving and strengthening each directions. Next slide, please. In this slide, you see the care cascade. As of September 2020, 70% of adult population has already been screened for HCV at least once. 56% of the target population initiated HCV treatment, and 98% of cases has successful treatment outcomes. Among 50,000 persons tested after their first round of treatment, 98,000 patients achieved SVR. Next, please. And now we are going to the testing algorithm. In the beginning of the HCV elimination program, different diagnostic methods were introduced through the country. Both rapid and laboratory-based serology methods were chosen to target and universal screening strategy. Ministry of Health designated a lead agency at central level that was responsible of implementation of HCV screening activities. In parallel, a web-based registry was developed to track screening outcomes among all persons tested for HCV infection. In 2015 and 2016, screening for hepatitis C has gradually been offered free of charge through several governmental programs across the country, covering general population, inpatients, outpatients, pregnant women, blood donors, harm reduction centers, military services, and other groups. Next, please. In that slide, you see quantities of screening. During the last 2 years, screening rate in outpatient clinics in general population reached more than 50% of the total number of screening conducted in all sites, with 1.3 positivity rate. Next slide, please. Next step in laboratory diagnostic is the confirmation of anti-HCV active infection. The diagnostic landscape for hepatitis C infection was introduced by different confirmation methods, and there were difficulties with the quality of tests. Reagent was not verified, and with the procurement of small batches also, it was cost issues. After introducing the HCV core antigen testing, confirmation became centralized and new diagnostic algorithm was approved. The decision was based on HCV core antigen testing, accuracy and feasibility study. The overall agreement between HCV core antigen and RNA test was 97%. Next slide, please. In that slide also you can see HCV testing algorithm that was implemented for the HCV confirmation. And next, please. Confirmation of HCV infection by core antigen using a centralized approach of confirmation. Introduction of core antigen test-based confirmatory testing was a game changer, enable the program to offer free of charge confirmatory testing all anti-HCV positive individuals. In 2017, Lugar Center, as a reference center for the hepatitis C, started performing core antigen testing and implemented centralized laboratory approach. Now, next slide, please. In that slide, you see HCV core antigen testing from December 2017, October 2020. And around 25,000 samples are received at Lugar Center and tested, and approximately 30% of them were non-reactive. Next slide, please. And according to the algorithm, these all HCV core antigen negative tests were tested on PCR, and approximately 11% of that negative and gray zone samples were HCV RNA positive, but most of them were very low positive and genotype was undetermined. Next slide, please. Despite the well-organized NCDC public health laboratory network and significant coverage of the country and sustainable access to diagnostics through centralized procurement of reagents at a fixed rate reimbursement system, centralization of confirmatory testing had significant disadvantages. Turnaround time of testing was up to weeks, and rejection rate of samples were very high. At the same time, some different confirmation methods were implemented in private public sector, and from November to now, 2018, confirmation testing of anti-HCV hospitalized individuals became centralized, allowing shortening the time from screening to diagnosis, active infection, and to treatment referral of patients. Since 2018, have implemented optimal and cost effectiveness testing strategies as well. The Gene Expert was introduced in the country. There was approximately, we have already more than 60 Gene Expert machines throughout the country, and we implemented the Gene Expert method using plasma and finger stick samples as well. Next, please. In that slide, you can see the variation of the methods, test kits, and equipments introduced in the country. Next slide, please. In this slide also, you can see confirmatory tests conducted by year 2015-2020 October. And you can see that during the last 2 years, confirmatory testing rate using Cepheid platform is increasing. The reason is geographical accessibility and easy performance and very short turnaround time. Next slide, please. Confirmation of HCV, active infection. This was also next step of blood transfusion safety in Georgia. Additional progress towards the elimination is also to strengthen a blood safety system and decrease the HCV transmissions through the blood donations. In 2020, in 2020, the blood state safety program, state blood safety program, launched NAT screening, and by supporting Global Fund, we procured the equipment, and 24 blood banks already are participating in the NAT screening. The NAT screening is performing at Lugar Center, and anti-HCV serology methods are introduced in the blood banks, and serology and NAT discordant samples all are testing for NAT discriminatory NAT testing. And also the anti-HCV positive samples are confirmed by using core antigen testing at Lugar Center. Next slide, please. Since 2017, the National External Quality Assessment Program has been implemented in Georgia with the support of CDC Atlanta. The NCDC Lugar Center is producing the national HCV proficiency testing panels for HCV, and the panels are sent out to all the laboratories involved in HCV elimination program 3 times a year. And they all receive data, are analyzed, and giving feedback to the laboratory to ensuring for the effective laboratory monitoring. The annual meeting stakeholders ensures the effective exchange of the existing issues and challenges concerning the HCV laboratory diagnostics, as well as provide the opportunity to introducing of new technologies and laboratory techniques for ensuring the good laboratory practice. Now, next slide, please. We move to the diagnostic costs. A significant number of patients did not have access to PCR testing, as the test was not fully covered by the National Hepatitis C program at this time, where we started the HCV elimination program. And out-of-pocket payment was 30% for vulnerable populations and 70% for general populations. In December 2017, when the core antigen testing was introduced in the country, first confirmatory testing of active HCV became free of charge of patients. Since September 1st, 2018, the genotyping of HCV individuals with active infection has been provided at no cost. But after introducing the pan-genotype treatment, HCV genotype testing is no longer required. And from August 2019, it has become possible for patients to receive diagnostic and treatment services free of charge at all. Next, please. Now about the current challenges related to COVID-19 pandemic. Unfortunately, in this slide, you can see that significant drop in screening numbers since the pandemic has started. Also, enrollment in HCV treatment remained more stable, but still the number is very low. Next slide, please. Now about the COVID-19 challenges in laboratory diagnostic part. They implemented laboratory network for HCV elimination through the last 5 years, played this fundamental role for the development of rapid response against the new coronavirus pandemic. Existing PCR diagnostic capacity allows with the decentralization and the rapid scale up of SARS-CoV-2 infection PCR testing capacity up to 1,250,000 within the 10 months period. And also based on the experience with HCV EQA program, new external quality program for COVID-19 infection was implemented through the laboratory network. And now, next steps, please, next slide. Next steps for hepatitis C testing scaling up. A revision of the existing elimination strategy is already planned, and we started working on new elimination strategy for the next years. And new HCV, HPV seroprevalence survey, along with COVID-19 seroprevalence study, is scheduled to be conducted in 2021. And HCV prevalence, genotype distribution, risk factors, and awareness education will be studied to assess the progress toward elimination and copia current situation in 2015. And strengthening the national laboratory system and countrywide national quality insurance programs by establishing the laboratory training hub and the ECHO hepatitis C diagnostic laboratory community. Now, in next slide, acknowledgements to all organizations, including Ministry of Health, CDC, EBO Diagnostic Find, and our National Center for Public Health Disease Control and Public Health, Georgia. And that was all. Thank you for your attention.